Hi, well, we're outside today in this beautiful setting, and we can talk about vitamin D. We're in the middle of Central Park, north. And why vitamin D? Well, because most people these days suffer from nature deficit disorder. And we see it in blood measurements of vitamin D, which have plummeted in the last 20 or so years. And truly, at this time, in 2010, in the United States, where we say we're not deficient in anything, thank you very much, actually, vitamin D is a huge problem. It's a huge problem because when we wear sunscreen, SPF 8 blocks vitamin D production by 95%. And it's a problem because we work long hours indoors. It's a problem because we wear clothing. It's a problem because we live in northern climates, like anywhere north of Nashville. It's an issue. Here in New York City, it's a gorgeous sunny day. I could be stark naked right now in the middle of Central Park and couldn't make a drop of vitamin D right now. And so, here's the challenge. How do we know we've got enough vitamin D? We can only know by getting a blood test. How do we know how much to take? We can only really know by getting a blood test. And what's a really good level to have? Well, probably 40 nanograms per ml. Now, can you ask your doctor to get you a blood test? Absolutely. Can the doctor say no? Well, looking at the data, they should not be able to say no. Should insurance companies be saying no? No, they really should not. So it really is, it's an issue. Vitamin D represents the single most cost-effective medical intervention we can do today. We're talking about pennies per day as a supplement. And the returns in terms of cancer, heart disease, the list goes on and on and on and on. And specifically for cancer, issues about how it regulates inflammation, it regulates all kinds of signaling pathways for cellular proliferation, differentiation, apoptosis. It regulates insulin sensitivity. So just taking a level from 10 to a level of 30, which is kind of bare minimum for a normal level of vitamin D, that change from 10 to 30 improves insulin sensitivity by 60%. The best pharmaceutical we have, metformin, improves it by 13%. I said, wait a second. Why are we focusing on metformin for breast cancer and not vitamin D? And here's my passionate belief. Fundamentals first, then pharmaceuticals. But as an internist, as a pediatrician, I was trained to think pharmaceuticals first. Forget fundamentals. They're either taken care of or they just don't matter. But when it comes to vitamin D, absolutely, they matter. Get your level tested, optimize your level, optimize your health.